May all beings be happy. May all beings be healthy. May all beings be free from harm. May all beings love life. May all beings awaken. Welcome to another Cuke Audio podcast and another episode of Life in Bali, our vacation away from all that Zen nonsense. I pray that you and yours are safe and comfortable and free from economic hardship and able to get out and do whatever it is you want within the limitations of the universal precept of do as little harm as possible. Today's guest on Life in Bali is Ayu Narayani, who we call Dr. Raya. And she's a doctor at the Global Health Center on the bypass in Sanur. Oh, one little tiny comment I wanted to make is that I have started to begin the Life in Bali podcast with May All Beings Be Happy, that thing, like I do all the Zen ones, because it occurred to me, why am I not doing that? Well, I thought, I'm leaving that for the Zen podcast. And I thought, but people here totally understand that. That's a very common. Everybody understands that here. Semoga semua hidup berbahagia. And it's really sort of non-sectarian. Anyway, so I'm including it in the Life in Bali podcast too. So anyway, let's give Dr. Raya a call and get right into it right now, okay?
Hello.
Dr. Raya.
Good afternoon, Mr. Dackett.
Hi. How are you?
I'm good. Could you hear me clearly?
Yeah, very clear.
Okay. 'Cause I'm wearing my earphone right now.
Oh, no, that's fine. That's good. So we call you Dr. Raya, but
Yes.
your name is Ayu Narayani.
That's correct, I said.
Yeah. So where does the Raya come from?
So basically, it's well, my name is Ayu Narayani, as you can see. I'm Balinese. And the part of my name that is, the Balinese part is Ida Ayu. So the first two.
Yeah.
So that's actually not a name, as more of a title with that kind of system in Bali.
Oh.
So my real name.
Please explain.
Okay. So my family come from a priest family.
Yeah, you're Brahmin.
Yes. So in Bali, you have Ida Ayu for the girl, for the woman, and then Ida Bagus for the male.
Yeah.
The boy one. So naturally, because I'm a girl, I got the Ida Ayu.
Yeah.
So my only name is actually just Narayani, and so I just cut it short in the middle. If you find the Raya part in my name, so that's just that.
Basically. There it is. Yeah. Staring me in the face, Narayani.
Yes.
Raya.
Yes.
And that's like a Sanskrit name, right?
It is. It is from a Sanskrit language. Yeah.
Um, does it have a meaning that you know?
Um. Oh, it's from what I know, from what my parents chose. So Narayan. So my name is the female form of Narayan. So the male form is Narayan or Narayana,
Yes.
and mine is the female form, so that becomes Narayani.
Yeah.
So Narayan or Narayana is essentially the other name of of Krishna, of God, of uh,
Oh.
basically the like Narayani, like the mother of all mothers, or like the mother of the universe, something like that.
Oh.
You know,
Oh.
like yeah, like the very female energy of Krishna or of the universe, something like that. So
Oh. That's great. Wonderful. Great name. Uh, and you, where are you from in Bali?
so my family is from Gianyar,
Uh huh.
uh, but to be precise, the city of Gianyar.
Oh, yeah.
Uh,
Yeah.
yeah, so both my mother and my father's side is actually they actually came from the two villages that is side by side with each other. So so they were actually neighbors and they know each other since they were kids.
Ah. Ah.
Yeah. So it wasn't difficult for them to fall in love, basically.
Uh huh. Uh huh.
Yeah.
And
And then mhm.
go on.
And yeah, so my mom came from a Balinese family, a Brahmin family as well. My dad also. But because in Bali you follow the bloodline of your father,
Mm-hmm.
um, so because my dad is coming from a Brahmin family, so hence my name. Yeah.
Hmm. Hmm. Hmm.
Mhm.
Hmm. So, I'd like to hear anything you'd like to share about growing up, just your life from growing up to becoming a doctor,
Oh, okay.
you know?
Yeah, yeah,
And well, I'll say right now, and I'll put it in the what they call the metadata, the information that's written that you see, that you're a doctor at the global, uh, what's it called? Global Health Clinic or
yeah. Global Health Center.
yeah, Global Health Center in
Mm-hmm.
Sanur. Very nice
Mm-hmm.
place.
Yeah,
Uh, and we just got COVID-19 tests there, my wife and me, administered
yeah,
by you.
yeah.
Um, and uh, can you explain that test before we get to your life story?
Of course.
Because, look, here's my question. Um, I've never had a test before. I knew there was the, what's it called, the CPR,
The PCR, yes.
uh, the, or the, the PCR, right, um, which is the a swab, and that's the one that determines if that's the expensive one. That's the
Yeah,
most
yeah,
reliable one, right?
yeah, yeah.
And then I knew there was the swab test,
Yeah.
putting a swab in your nose or throat,
Mm-hmm.
and that was called the rapid test.
Yeah,
And
yeah.
that didn't tell you actually if you were positive or not necessarily. It told you if you had antibodies, right?
Sorry, could you repeat
It
the
didn't,
last?
it didn't,
Mm-hmm.
the swab test didn't tell you if for sure if you were positive for COVID-19. It checked for
Mm-hmm.
antibodies. Is that right?
Okay. So maybe we clear out the concept first, yes, Mr.
Yeah,
David.
yeah.
So yeah, okay. So the available three tests at the moment, both in Indonesia and actually worldwide for the COVID test. So we have the rapid test, yeah.
Yeah.
and then the PCR test. So the rapid test, you have two kinds of rapid tests. One is detecting the antigen, and then the second one is detecting the antibody. So why is it called rapid test? It's because it's essentially the sample is taken out very simple, and then the result of the test is obtained within a rapid minutes. Yeah, like both of them are within 50 minutes. You can expect the results, basically. And then for the other one, the PCR, that is the one that is detecting the antigen. Yeah, the same as the rapid antigen. And then the method of taking the sample is also the same. Actually, it's a swab test. So you either get the sample from the nose or the throat. So what's different about that and the rapid one is because the PCR, which is the polymerase chain reaction, it's just different in terms of how the sample is being analyzed. Yeah, the technique is different, and then it's using a centrifuge machine, and basically you are taking out the RNA of the virus, which is basically the antigen, and it costs a lot more, yes, and the accuracy is up until now, it is still the standard for diagnostic.
Yes.
Yeah. So why does the rapid test exist? It's basically, if we could put it this way, it's a screening test. It's a screening method, yeah? Because it's cheaper, it's faster, it's quicker, and you can easily distribute that to many other places that doesn't have the facility to run through a PCR test. Does that make sense so far?
Yes.
Yeah. So if we, like, let's say I have a patient and that patient just had a contact with a positive result, a COVID patient, what's available in our clinic is the first stage, the screening test for it. I will offer that person to get the antigen test, which is the rapid swab, the one that we did in the clinic with you and your wife.
Right.
Yes. And then once we got the result, for example, if it is reactive, yeah, if it is reactive, it's already capturing 95% of the truth, basically, because the sensitivity of the test, the one that we have right now in the clinic, is around 95 to 96%. If we want to confirm it, we offer the patient, if we want to confirm it, then you can get the PCR result to basically have it confirm diagnostically that yes, you are COVID-19 positive. Or if the patient, I'm not saying refuse, but if the patient feels that okay, they're confident enough with the result that it's positive, then we ask them to self-isolate for 14 days at least, and then for the whole and for everyone around him or her that has been in contact with that person for at least the past 7 days to get a test as well. And then what happened is after the 14 days has passed, after the quarantine, we ask that person to come back for the antibody test, just the second one, the second type of a rapid antibody.
Is that the antibody? Is that the pinprick?
Yeah, that's the pinprick one. You have some clinic that does it with the pinprick, and the other bigger clinics that takes the blood from the vein on your arm. But that's yeah, that's just essentially the same. It's a serology test. It's detecting whether you have the antibody or not, and then you have two types of antibody. First is the new one, which we call the IgM. And then the second one is the IgG, which is the old antibody. So essentially, from the day you were infected until you develop the IgM, that takes about 10 to 14 days. Yeah. 10 to 14 to sometimes 20 days, which is why we ask the person to have it tested again to know whether you have developed the IgM or not. And why do we need to know that? Because when you still have the IgM, you're essentially still battling the infection within your body, right? And you're still very much contagious. So that tells us whether you should be back in quarantine again or not. Whereas if you have the IgG, which is the old antibody, your body will develop that between 21 to 28 days. Yeah. If you have the IgG, that means you are already done with the virus battling. Yeah. And you are recovered from it, and you're actually having antibody towards it, or like immunity towards it. This stays as the time being that we're speaking right now. Most of the case reports are showing that it stays within the patient's body until 4 to 6 months after the infection, the IgG. So yeah, so we can expect
Does that mean they're resistant for 4 to 6 months?
It doesn't mean resistance like completely, because there has been reports of patients getting a second infection after they've been COVID positive before. But it does mean that when you do get the second infection or third infection, your symptoms are not as severe as the one when you got the first one. Does that make sense?
Oh, really? Really?
Yeah.
Yeah. Well, yeah, it makes sense.
I mean that's the finding from case reports that we are that available. But that's a very, very rare finding. Most people who already got infected and built the antibody, they don't get the symptom, the infection again.
Yeah, yeah, yeah. I like statistics, and
Oh, great.
well, you know, I'm not a statistician, and I don't dwell on it. But like in terms of following the American election,
Right.
I would primarily look at statistical analysis, which is not understood very well because people expect it to land right on the middle. You know what I mean? If you say there's a 10% chance, or if you say there's a 90% chance something will happen, it might not happen, right? So what I don't like about newspaper reporting is when they don't give you a sense of where the report lies statistically. In other words, when they say a report of somebody in South Korea who got it, the virus the second time, I want to know right away what percentage of what percentage of people that happens to, how common is it? When they report on countries, they say New York has the most of any state. I want to know with the percentage, does it have the highest percentage of any state? Because you know what I mean.
Yeah, you're asking about the percentage of patients recovered and getting the second or third infection,
yeah? Yeah, I don't expect you to know that, but you said it's very low, and that's sort of a statistical comment. You might not know the exact one. Anyway, so all right. Following that, have you been around a number of people who have tested positive, and so that you might have a sense of, say, how many have severe cases, what percentage have symptoms that continue for a week, 2 weeks, 6 weeks, a month, half a year, I read about these things. I want to know what percentage of people does that happen to. What I just read today was 1 in 5 people are having symptoms continue for weeks or longer.
Okay.
What have you noticed in it, or have you had enough experience in that realm to notice that sort of thing.
Okay, so what I can tell you is what I see and what I experience in the clinic. Yeah,
Yeah.
because I mean, I can tell you the national or the Bali things, but those are numbers and those are not facts that I see uh, directly, closely,
Yeah.
correct? So, like for example, in the clinic, uh, I would say our from all the tests that I have been doing, the positivity rate of COVID-19 patients in our clinic is quite low. So I would say it's somewhere between 5 to 10%.
Uh-huh.
But those are the people who came for us and tested with us.
Yeah.
Yeah. And so yeah, it's around I wouldn't even say more than 5%. I would say somewhere between 4 to 5%
Yeah.
so far.
And so that's 4 to 5% out of people that had some reason to be concerned.
Yeah, yeah. So the kind of people that come to our clinic for tests are, I would say, the majority of it, and when I say the majority is about 70 to 80% are for traveling purpose.
Ah.
Because as we know, for domestic flight, for domestic traveling, people are required to have at least the rapid test.
Yeah.
Yes. So around 70 to 80% that comes to our clinic for the test falls into that category.
Yeah.
And then the rest of it, the 20 to 30%, those are actually the people who either have like or feel that they have the symptoms, or they have been in contact with someone who is probable of having the COVID-19, or
Yeah.
someone who is actually confirmed to have the COVID-19
Uh-huh. Uh-huh.
virus. Yeah.
Uh-huh. Uh-huh.
So, and among all of those division percentage of reason, I would say still the positivity of rate, the positivity rate is somewhere between 4 to 5%.
Oh.
Yeah.
I did wonder that.
Hmm.
Now, when I met you, you were wearing a mask, and
Yes.
on top of the mask and your entire body
Yeah.
was a white suit, which made you look like an astronaut.
Yes.
With a visor built into it in front. And I immediately asked you if you were hot in there, and you said yes.
Oh yeah, definitely.
Oh.
I can tell you that's not how I usually dress, but for for work purpose, yes, of course.
Yeah. And what is that suit called? Do you know?
It's called a hazmat suit.
Pardon?
The hazmat suit.
I wondered if that was the right word to use. Hazmat, right? Yeah.
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 What do you think? So, does that like have any semblance of any other suit, or do we not call it hazmat suit? I don't actually know. Like, why do we call it hazmat suit? But like within the medical community, we just call it hazmat.
Yeah. Um, so, one thing I asked you then, I asked you, do you throw that away?
Yeah. Yeah.
At
Yeah.
what rate? Do you wear more than one a day?
No, 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 no. Actually, for the whole day, I just wear that one because, like, not everyone that comes to our clinic comes for the COVID
Oh, yeah,
uh,
of course.
test. Yeah,
Yeah.
and to be honest, like, I do have another protective gown, which is not as serious as the astronaut suit that
Yeah.
you saw me wearing.
Yeah.
Usually, I wear those for patients without any. So I'm not wearing that every day or for every patient, but usually because I know during the day how many of COVID-19 tests I would be doing, right? And if I see the list of patients are, I mean, like 80 or 90% are going to be doing the test, then I'm wearing that. But if not, then I'm wearing the other kind of protective gown.
That,
But yeah, I would say maybe like I use that suit for 1 day or 2 days, and then
oh,
I
uh-huh.
throw it in the in our medical waste bin.
Yeah.
And I remember you were asking about, oh, can you wash it, or
Yeah.
does it have to be thrown away? I mean, yeah, like believe me, I also like a lot of times this is like conflicting with my own with with my own ideal, because like we're throwing so many medical waste, especially during this pandemic, and a lot of people are wearing masks, right? I mean, which is good in one side, but also in the other side, I can imagine like the amount of extra medical waste that is produced on a daily basis.
Yeah. Yeah. I definitely have concerns and ideas
Yeah.
about that, but I think that's a big subject that I will leave by. I mean, I just can't believe that things can't be sterilized or, uh, mm, something could be done, but, uh, and, I see waste as a major global problem that has real
Yeah.
health
Yeah. Implication.
ramifications
Yeah.
globally.
Yeah.
But
Yeah.
uh, all right, so now will you tell us what happened from the time you were born till the time you became a doctor?
I don't know, Mr. David. Will that be an interesting one?
Yeah, it'll be
Okay.
interesting. Um, yeah,
Okay.
yeah, it'll be interesting. You have a very nice voice. You have a good delivery, and
Yeah.
I want to hear it. I want to hear it.
Okay. Okay. Well, so I I was not born here, actually. I was born in Jakarta,
Oh,
because yeah, because as soon as my parents got married, I told you earlier that they were essentially neighbors when they were kids, right, in their hometown.
yeah.
So as soon as they got married, they left to Jakarta, get a job. Actually, my dad kind of lived in Jakarta before that, but then they were dating, and then they got married, and then my mom followed him to Jakarta,
Mm.
and so I was born and mostly raised there.
Oh,
But I've been living in some other places. I moved to Bandung, that's in West Java,
yeah.
following my mom because she was doing her residency in ophthalmology. My mom is a doctor as well.
Mm.
And yeah,
Mm.
so me and my brother and my sister, we came there and then spent some years again in Jakarta. And then for a short brief of time during high school, I lived for a year in Norway.
Is
And
that right?
yeah,
How was that?
so I got,
How was that?
oh my God, that was so different. I got a, I got a student exchange scholarship basically during high school, so that's how I ended up in Norway. It was a, it was an experience, I can tell you that. Because like, I mean, you've lived in Bali, yeah, like, you live in Indonesia, and you see the weather, how it's like. We have
Yeah, right.
12 hours of sun, yeah, during the day, and then 12 hours of night. And it's pretty regular like that every day. You can most definitely expect that to happen, yeah.
Right, right.
But in Norway, where I was lived, and it was not just in Norway, it was the North Norway, so it is like far
Oh,
above in the north.
wow.
I experienced the kind of winter that, yeah, the kind of winter that they describe as mørketid,
It,
which means like the dark time, the dark winter,
uh-huh.
which I didn't see sun at all for 5 months.
How long? How long?
About 5 months.
5 months. Oh my gosh. That
Yeah,
is unbelievable. You
yeah,
you know
but
the difference here in
that
Bali,
was.
between the longest stay and the shortest stay is 1 hour and 1 minute. So,
Yeah,
yeah.
I remember there were days where I was like I went to school and it was dark as the night, right?
Uh-huh.
And then the only time I saw like a ray of lights, this was not even like sunlight. No, it was just ray of lights. It was around 1 p.m. or 2 p.m. I was still in class at that time. And then after that it's completely dark again.
Oh,
That's like
wow.
that throughout the whole winter. But then it come the summer, it was 24 hours of light. Like I remember during the midnight, so that's why they call it the midnight sun. So, but during the summer, you have the 24 hours of light, and around midnight, you see the sun is like setting, just like the same here around 6 p.m. Yeah, but you see it on midnight, like 12, and then the sun set for just about a shy 2-3 hours, and then it rised up again.
Ah.
It was definitely an experience for me,
Mm.
an extreme comparison of experience, but all in all, I was so grateful that I had that because like being 17 and I went away on my own, living with a Norwegian family who hosted me for the whole year, learning the culture, learning to speak the language in a condition that was completely out of my comfort zone. I was really, really grateful that I got to have that experience when I was still young. I mean, I am still young right now, but
Yeah, you are.
but that's but at 17 it was like more than 10 years ago for me. So
Uh-huh.
yeah, it was a great learning experience for me. Yeah.
Wow. And
Yeah.
what was the family like and the Norwegians you related to like?
They were a very, very nice family. So I live with two family. So the first one was kind of a welcome family,
Mhm.
and then the second one was a more permanent one, and they both are a completely different. They have a completely different lifestyle, put it that way. So the first family, my Norwegian dad was a cardiologist, and my mom, who was actually Swedish, was a nurse, and they worked together in the same hospital, just different department. So they had like a very like active lifestyle. Yeah, they're the kind of people that like cycle to work or either ski to work, and then they have like a cycling tour every year in either France or Italy or whatever in Europe.
Mm.
And they're very healthy fit people, and they cook like amazing food at home.
Yeah.
and, and the other one was also completely different people, but all in all, uh, they're a very like very warm and welcoming. They're not the most like, I mean, Norwegian in general, not like the most welcoming people at first. They
Oh, I
they they
certainly have
they keep
heard that.
like they keep their distance. Yeah, like they keep it at a respectful distance.
Right.
um they might come off as a bit reserved
Yeah.
in the beginning. I mean, compared to Indonesian people, yeah, I'm just comparing it to my own people, and
Yeah.
how quite welcoming and warm we are towards like foreigner. We ask people like, oh, how are you, where are you from, what do you think about here, that kind of thing.
Oh,
Yeah.
yeah, I know very well.
But
Yeah.
yeah, I'm sure you do. But like there, I mean, people don't just like jump into you, ask you questions or like being like that, because in a sense, like I kind of feel that they respect people like privacy and distance,
Right.
and even when they talk to other people, like it's becoming like a joke as well, like like the Scandinavians, you talk to them, you keep like a meter or 2 meter distance.
Uh-huh.
Yeah. But once you get to know them, once you are welcome in the circle, they are the most like respectful, considerate, and genuine people
Mm.
that I've ever met.
Mm.
Yeah, so it was all in all a very good uh, experience for me, and a lot of of course, like I mean, it was a completely different culture, right?
Yeah.
And I've seen a lot of like values that is different and being delivered differently within the family, and I love how they are quite a like I would say a family-oriented community or society as well,
Yeah.
because they want to they're very like progressive in their way of man and woman equality,
Yeah.
and then the work-life balance, which I really witness with my eyes. And I don't know if that's something that is utopian for for Indonesia, but I kind of hope that somewhere in the future we might be able to have a for women to be able to take a maternity leave, and not just the woman but also the father, the new father, to have a like paternity leave like they have, for
Is
example.
there not paternity leave in Indonesia?
A maternity leave that exists, yes, but it's a very short one. I think with the new regulation, it was cut down from, I think it's from 3 months to 1 month right now.
They cut
Not
it
quite sure.
down? They went in reverse?
Sadly, yes. And there is no such thing as paternity leave.
Yeah.
So it's only mothers who get it, which is in a sense it's kind of ridiculous, right?
Yeah.
Like like that baby come from one sperm and one egg.
Ha.
So
Yeah.
so I'm not saying that it's the responsibility of men as well to take care of the baby. No, but it's like it's such a golden period, a window period for the bond to happen as well. I mean, you can attest to that, Mr. David. You have children. I haven't, but I've seen like how beneficial it is for men to build a bond, to have that kind of uh, yeah relationship as early as possible with a
Yeah.
kid. You know.
Yeah.
Yeah.
Well, I certainly had that. I was involved in the birth of both my sons,
Exactly.
and they
Mhm.
were
Mhm.
natural. One of them was
Mhm.
on a farm, and
Oh wow.
the the second one, it was in Japan. Yeah, a Buddhist farm. The second one was
Oh.
in Japan at a birthing center. And that's
Oh
very
wow.
common in Japan's really good about childbirth, and natural childbirth
Mm.
is the
Mm.
norm there.
Mm.
Uh,
Yeah. Yeah. Yeah.
and they have birthing
Oh, that's
centers. We
good.
had a choice. We had choices of where we lived, and which was not a. There weren't a lot of foreigners there. There were some from going to a center that's only midwives to
Mhm.
one that has
Mhm.
a doctor in charge with midwives doing the births, doctor overseeing it, and
Mhm.
more options to the hospital to, you know, the most, to just like America. You got the whole
Yeah.
gamut there. Um,
Mm.
what's childbirth like in Indonesia? In terms of that, what I'm sure you got quite a gamut here too. A lot of home birth, huh?
Uh, for so before I worked here in Bali, because I went to med school in Yogyakarta.
Yeah.
It's another town in central Java. So I lived there around 6 years.
Oh yeah, I love
And
Jakarta.
yeah, me too. It's a nice place. And so we were stationed in district hospitals, yeah,
Uh huh.
which means like hospitals in a rural area or not in a big city, basically, to do our practice before we got our MD certificate, license, sorry. And so what the kind of childbirth that I witness, most of the people right now have a medical, like government insurance.
Yes.
that would allow them to basically give birth in a hospital setting for free.
Uh-huh.
And
Yeah.
so that's kind of like the norm, even for all kinds of economic layers of society. They have access to give birth at the hospital, or like a local midwives.
Yeah.
So when we're talking about home birth, that's mostly being done by professional midwives in a practice setting of their own, usually their house, yes, but it has acquired a certain standard for home birth, basically.
Uh-huh.
Um, yeah, there are still a lot of those, but it's not the kind of home birth that in the past were done by, I don't know what's the English term of it, but like a traditional birth attendant.
Yeah. Yeah. So you
Yeah,
mean you mean there was there in Bali, if you go back into the history, there were people who I would imagine women who had the role of helping with births.
yeah. Like what we call as the traditional birth attendant, not just in Bali, actually everywhere in this archipelago. But that has been, I wouldn't say eradicated, because in some area that still exists, but by the regulation, they were not being, like I said, eradicated, but they are being educated
Yeah.
by professional midwives. So they're still allowed to be there to be present during the birth of the woman, because some of these women, they are passed through the role from generation, yeah, maybe from their mother, their grandmother, great grandmothers, and it's becoming like a cultural uh, like a cultural role, and they have like kind of this distinct role within their community.
Yeah.
And but the target is not for us to diminish them completely, because all in all we still need to respect the kind of local culture that exists there,
Right.
right? So what we do is that we work together with them, we collaborate, and we make the professional midwife as the one who attends the whole medical procedure with a certain medical standard, and the traditional birth attendant to be there like a maybe you're familiar with the doula kind of role.
A,
Yeah,
a
to
doula?
yeah, uh, doula. Do you know what a doula is?
I do not. I know what the term bidan for a midwife. That is bidan the more professional midwife.
Yes,
Yeah.
yeah. But the traditional one is there for basically like the emotional support for the mother,
Uh huh.
or yeah, anything that is not like medical procedure related. That's in some places this kind of collaboration still happen, but in a lot of places this is not. This doesn't exist anymore because the presence of this traditional birth attendant more and more has diminished,
Yeah.
and we have more and more trained midwives
Yeah.
basically.
Well, you know what comes to mind with me is again
Mm,
statistics. Like there are places where the traditional midwives have a very poor record in Africa,
yeah,
and
yeah,
they
yeah,
really have to get rid of them.
yeah.
You know, there's government programs to change that. So, uh, what's the track record for what's the for the for the doula? Huh? That's a good word.
Uh,
It sort of goes along with Balian, huh? Uh,
kind of like, yeah. Well,
Balian's
you know the
like a
concept,
shaman.
yeah, you know the concept of Balian already.
Yeah.
So yeah, in Bali the term will be Balian, and in another place like Java, for example, you would hear more the term like dukun beranak.
Uh huh.
But it's basically kind of the same. But Balian is more kind of a general practitioner, not just uh, for giving birth, but like dukun beranak is more of a like a traditional birth attendant, I would say.
Uh huh.
Yeah, and like you said, in Africa, it does have a lot of like bad track records, which is also kind of the same here, and that's why hence the approach of not diminishing them by force, but taking them and in collaboration. Because I mean, I don't know how they approach it in Africa, and I don't know whether a more forceful program to eradicate it would actually work. But here, what I could say is this kind of collaboration model, this kind of collaboration method works a lot better. But also, it would have something to do with the culture of the people as well.
Right.
Yeah,
Well,
Indonesian is not the most like
right.
confrontational people.
Right. And
I would
Africa
say.
has many, many, many cultures. So
Yes,
I
exactly,
just,
exactly.
actually, the problem I'm familiar with just had to do with one particular country and one culture in it
Yeah,
that was
yeah.
rather widespread, big problem. Uh, so
Mm-hmm.
here in Indonesia, you'd have the same thing. I'm sure that there would be, because you have many cultures in it, so many subcultures.
Yeah, yeah,
Uh,
yeah, yeah.
um,
There are still some areas that are really, really adamantly against a modern approach of like childbirth, uh, because just a very strong cultural uh, yeah, custom there,
uh,
and
where?
like a lot of these women who so I've been traveling to like some area in Nusa Tenggara Timur, in the East Nusa Tenggara, the Flores, those part,
Oh yeah,
and then
over
in
to
some,
the
yeah,
east of here.
yeah, to
Yeah,
the east of here, and some part of Maluku, some part of Papua as well,
yeah, that's what I was
where,
wondering
like I
about
said,
New
mhm,
Guinea, Papua,
yeah, yeah,
there.
and some of these women, they don't just hold like the role of a birth attendant, but they're also like a spiritual leader or someone that's like a key opinion leader within the community, stuff like that. So we want to be very careful to deal with this kind of this kind of culture, this kind of custom, because in one side, yes, we do care about the safety of mothers giving birth, but also in another part, we want that kind of change to be welcomed and sustainable, right?
Yeah,
And for a lot of places, it's not. I mean, a lot of places here, it's not a good approach to have that kind of forceful coming there and then tell them what they've been doing is wrong, and then this is how we should do it. This is
right.
how things are should be done. Most of the time, it doesn't work.
Yeah,
So that's why the model, the approach that we're using here in Indonesia most of the time is to get a collaboration between the traditional birth attendant and the modern medical
yeah,
workers.
yeah. Um,
Mm-hmm.
uh, in terms of people's following the guidelines for how to what to do, how to behave with COVID-19. Um,
Mm.
it seems. I mean, I have not been aware of any resistance like you have in America and Europe, but you might be more. I know there was this one guy who was in the rock band Superman is Dead who got 2 years
Oh,
for
yeah, 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 yeah.
leading a demonstration against masks, but it was
Mm-hmm.
uh,
Mm-hmm. Mm-hmm.
uh, on a very small scale and sort of a semi-punk thing to do. They were pretty rough on him. Uh,
We actually have a few patients or a few clients that came into the clinic. When I say a few, it's a very few one, because if you remember the entrance to our clinic, and then we have this banner that says face mask required, and
yeah,
then like stuff like please use it at all time when you're inside,
right.
stuff like that. And but we do have like occasionally some clients who are a bit more stubborn and obeying the rule. Like either they don't have the mask at all, or they do but they take it off whenever they can, or they just refuse to use it. But right now we provide the mask and you cannot enter without it,
Yeah.
because we've been meeting this kind of resistance, although in a small numbers. But again, what I'm saying right now is those who came into our door and we see with our own eyes. Yeah, outside of the clinic, I do see a lot of I wouldn't say movement, but this kind of tendency as well in some areas where I mean, you probably know and familiar with it. Some areas in Bali, I would name it, where a lot more young people are gathering there, thinking that they're invincible towards the
Right.
virus, and just living carefree,
Yeah.
basically.
I'll see. Um, we live in Blanchong, right? Murtasari
Okay,
area,
yeah.
right?
Mm-hmm.
So I've taken our dog walking, or I'll be walking down Danau Poso, and everybody on their
Yeah,
motorbikes,
that's nice.
everybody out there
Mm-hmm.
either is wearing the mask or they have it like, if they're outside, they might have it just below their chin if they're not near anybody. But
Mm-hmm.
there's really no obvious resistance. But then I get to the Banchar, right on the corner, the meeting
Mm.
place, the neighborhood meeting place, and every once in a while, I'll
Yeah,
see a
yeah,
group of
yeah.
young people in there, right? And they'll just be sitting around right next to each other, talking and everything without masks, like you said.
Yeah, yeah, yeah. Yeah, even like I mean, and I told you I'm Balinese. I still have my big family back in Gianyar, and then as you probably have seen that we do have a lot of ceremonies and
Oh, yeah.
gatherings and stuff. Yeah, and for a while, like I would say at the start of the pandemic, there was a concern. Like I would go into my hometown and I would see that people are all wearing the mask, and then the elderlies are more disciplined because of course they think that they're at a high risk. And then my cousins, the younger ones, are always wearing it. But and the amount of people that enter the temple were also limited. But like right now, more and more we see people are starting to be more relaxed. I don't know if there is some kind of um I feel like people felt kind of saturated
Right.
with the whole things, because I mean, let's be honest, it's been like the whole year we're living with this,
Yeah.
yeah,
Yeah. And
and
it's
a lot
been
of people
closed.
are
It's
just,
it's been really closed since what, March?
yeah, yeah. I mean, the first case in Indonesia was found in March, but I'm sure before that something exists already. We just didn't detect it yet.
We were aware of it before March, but from March it's been much more serious. And then there was
Mm,
this long period where the beaches were closed,
yeah,
which
yeah, yeah.
doesn't make much sense to me because we go to the beach.
No.
We don't even we don't get near anybody. But what happens is that the Balinese come to the beach in groups and
Yeah,
get
yeah,
near each other and everything. But you know what?
yeah,
They'd only monitor every access for 2 days, and
yeah,
after a
yeah.
while, I'd notice Indonesians going in, Balinese going in, so I'd go in after them, just walk around a little. Mainly, I stayed away though. But uh,
Yeah.
well, anyway, um, but it's not like America, uh, uh, where you have really serious resistance in places in Europe.
Right. Yeah, yeah. I would say it's a lot more subtle. I mean, the resistance is there, but it's a lot more subtle
Yeah,
than what exists in America or Europe,
yeah.
like for example. but it's there. It is there. Just it's not more. It's not as as loud and as rambunctious as as what we witness in the news in America.
So Bali is doing generally better than Indonesia, a lot better, right? Or than some places in Indonesia. Indonesia is so varied.
Yeah,
I mean, Java has
yeah,
had much more, right?
yes.
Percentage wise.
Jakarta to be Jakarta to be precise.
Surabaya.
East Java, Surabaya. Yeah, that's East Java. And yeah, because like if you see just by the simple one is the number of population there, and the whole Java you can easily count 140 to 150 million living there. And in Indonesia in total we have like what, 270
Yeah,
million.
yeah.
So like it's like more than half of the population live in one island already, and the rest of 17,000 island is just a shy of 100 million-ish people spreading. So just in terms of like density of population, that already contributes a lot to the rate of transmission. And then the mobility as well, because in Java, like it's very common for them to travel from one province to the other or one state to the other as a simple means of working. For example, in Jakarta you have the Great Jakarta and then the metropolitan area, and most of the people live in the outskirts of Jakarta, but they work inside Jakarta, so they commute every day. That on its own is already uh, you know a huge contributing factor. They are cramped in the public
Oh, yeah.
transportation. They were, yeah, it's a highly density population. Jakarta itself has what, around 10 million, and then the Great Jakarta, that means the inside Jakarta plus the outside
Right, right.
Jakarta, that has 30 million to population.
Yeah.
So yeah, it's quite dizzying when you think about the number.
Oh, wow. Yeah.
Yeah.
Yeah, I remember when I was a kid reading Indonesia as Java, not Indonesia, but Java
Hmm.
as the most
Hmm.
densely populated place on Earth.
Yeah.
But
Yeah.
but it's not anymore, I don't think.
Yeah,
But it's
maybe, yeah.
dense.
It is dense. Really, really dense. Yeah.
uh, yeah. So how do you think Indonesia? I mean, Asia's doing better than the rest of the world, is my observation. But Indonesia is not doing as well as say Southeast Asia.
No,
But
no.
Bali seems to be doing very well. But this is not. I mean, this is just observing from looking at the news, and I look at Safe City, Denpasar,
Uh-huh.
and
Yeah.
what's your take on it?
Well, in terms of how we are, well, we're going to close the 2020 and we're entering 2021. But if I look at the rate of transmission, the infection, the curve, the daily new infection, daily new death, it's for me. My take on it is that we're going to be in it at the rate that we're going right now. We're going to be here for a while because, first of all, we haven't seen the peak of the epidemiological curve.
Yeah.
We're not there yet. we're still very much in the first wave. We're still in the middle of the shitstorm. We're probably not in a huge shitstorm yet,
Uh
but
huh.
I'm talking on a scale of Indonesia. Yeah.
Yeah.
So what does that entail is that it's gonna take a while for us to reach the peak, But at that time, then if we have reached the peak, then we can expect things to be going better and down, like the rate of transmission decreasing.
Right.
But up until now, we haven't seen it yet, because like on a daily basis, the daily tally nationally, we see the new infections at the rate of 7,000, 8,000, which like just a shy 1-2 weeks before that was 5,000 ish, and it's quite a jump, you know. And
Is that you're talking about Bali or Indonesia?
I'm talking about nationally Indonesia.
Right. See that, look,
Yeah.
at 7,000 nationally, America's getting several hundred thousand,
Yeah, of
you
course,
know.
but we're also talking about testing capacity here. So it's different, the number that is reported and tested, than the real number.
Yes.
The real number, the actual real number, is the one that we don't have. So we can expect a lot of people who are infected but not tested
Right.
to be existed. So like in the latest model that so I went to school in London after my graduation to take my master degree, and
Oh,
then
there you
so
go.
there you go, and it's a public health school, and the school that I went to, they make a mathematical modeling as well, that in Indonesia, well, this was a model around April, May, June,
Mm-hmm.
that in Indonesia you can expect that for every one patient confirmed with positive COVID-19, you can expect 20 other people who actually got the symptoms and to be positive as well. So that's like 1 and 20. So if we have like right now around, let's say, 1 million, you could expect actually there are another 19 millions that we don't know if they
There you
actually
go.
have it or
Yeah.
not.
Well,
So
I see. I love to see things like that, and I think that should be that sort of statistic, that sort of information should be front and center. And I
yeah,
assume that. I didn't know that, though. I didn't know that 20 to 1. That's more than I had assumed. But what about X? It seems to me one thing it's hard to hide, uh, and much easier to see is excess deaths and,
yeah.
and excess, and if you want to go, excess hospital entries and like that. Do you have a sense of, do you have any knowledge or a sense about the excess death here?
Due to COVID, you mean?
Yeah. Uh, well, no, just like back when in the summer when America had like, I don't know, 170,000 reported deaths, there were actually about 250,000 excess deaths for that time of year, for that year. In other words, that year, 250,000 more people had died
Yeah, 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 yeah.
than the year before, and that's also including adjusting for population change.
Mm,
Uh,
mm.
uh,
Uh, Yeah, unfortunately, I don't have the exact number of it, but what I know from hospitals, they do have uh, more excess death, but due to the COVID one, and the reason for that as well is a lot of people more and more are not accessing the medical facility, uh,
right.
which they should be, like for example, like a regular patient of hypertension or like diabetes, those who are expected to be, to visit the facility every month or every 2 months, is not there, and more hospitals are more concentrated or focused in battling the pandemic. A
Yeah.
lot of departments that doesn't deal with it directly, they have to like rearrange their staff uh, to the front, to be, to deal with the virus, with the surge of patients. So we do see in some department, like strangely, I see another report the other day, orthopedic surgery was like increasing during this pandemic.
Oh.
I don't know why, but in other departments, things were looking really, really slow. Basically, I had a friend who works in urology department.
Uh-huh.
Things have been very like slow in there. A lot of departments are actually, yeah, like doing whatever everything they can to be in this one and in this one sector
Right.
battling the pandemic. Yeah,
Right. I went over to
that's what I know.
Bali Mandara.
Mm.
We live walking distance from Bali
Yeah,
Mandara, and I love Bali
yeah.
Mandara. Uh, and I saw a urologist, a cardiologist, and a dermatologist in the
Hmm.
same day.
Hmm.
Um, and definitely it was easier. They weren't as busy. And also, I had put off going there too. And so I think there's two types of deaths that would, pardon me, would be counted as excess deaths. One would be actual COVID-19 related deaths, like it was either
Yeah,
died from COVID-19 or that they had COVID-19 and died from something else because it weakened them. And then the other
yeah,
thing is what you say is that people weren't going to see their heart doctor or weren't when they had signs of stroke or heart
yeah,
disease didn't go there
yeah,
because they're
yeah,
afraid to get it.
yeah,
Those two
yeah,
types. So
yeah,
yeah. So anyway, I think we can agree that the COVID-19 has a greater effect than we than is acknowledged in the news
yeah,
or the reporting.
yeah, yeah. It might seem like I mean, transmission wise, it's by air, so that's why, like it might could seem just like a normal like flu symptoms, but what the virus did or attacked in our bodies is completely a different things than just a flu, because in a lot of patients it's causing the blood clots, and that's what or that's how it gets them, basically, in short. If we're using the concept, the epidemiological concept of immunity, which means the amount of population that has the antibody towards it, either they were once infected or that they're vaccinated against it. So in simple terms, it needs to be around 80% of the population
Right.
to have the antibody to be, for it to not be a health threat anymore. That's what a lot of people uh, mentioned already about the herd immunity. So you will get that essentially by either getting infected, so therefore you build the antibody, or you are vaccinated against it.
When is Bali? Yeah. When is Bali going to get the vaccine? Or there's two main vaccines now are going to be available in America: Pfizer and Moderna.
Yeah, yeah.
Do you know what is projected for here?
Uh, for not just specifically to Bali, but the government of Indonesia has a collaboration with Sinovac, and then there's a like Indonesian product, a Bio Farma. Um, one is a Chinese one, and the other one is being developed in West Java, actually.
Mm-hmm.
So they are preparing for it for next year, basically middle of 2021. to be the first. I think that's going to be the first dose injected. Like for now, they're concerned with the stage 3 clinical trial, and then to get the enough amount of dose for the first batch. And so yeah, we can expect to see it somewhere between summer next year or the second semester of next year.
Uh-huh. Uh-huh. Um,
Hmm.
so, uh, so Indonesia being still considered a third world country, not, it won't get it as quickly as America and Europe. Is that going to happen?
Well, I wouldn't imagine uh, not the product that America or Europe use. And from what I understand as well, in the US, the first batch of doses would be uh, concentrated focus for health workers and elderly
Oh, yeah.
first, right?
Yeah.
And I think that goes the same with Europe as well. And in terms of distribution chain, I think it's gonna take quite a while for Indonesia to have a huge percentage of its population being vaccinated
Will it
because
cost anything?
oh, that's the one that we don't know yet because the reason this is only I got from news as well. The recent updates is that for a certain amount of first batch doses, like 30 to 40% of them are going to be free, and then the rest are going to have to be paid. And there's been a lot of debate on it, on and how a lot of people uh, protested that it should be free, it should be given free.
Yeah.
And so yeah, we'll see how things are going. At the moment, it's just well, being debated, basically. I mean, I don't know if it should be debated. I think it should be free. So
Yeah,
so
definitely
we'll
should
see
be free.
how
But it
yeah.
doesn't have to be free for you and me. But
No.
I mean, it should be free for you because you're a doctor,
Oh
right?
yeah.
I was thinking
Yeah.
of I was just thinking of like income level or amount. I mean, we're not rich, but we're rich compared to a lot of people. I mean, the way I look at it is I don't want to take the vaccine before about 20 or 30 Indonesians that I'm close to, Balinese and
Mm.
Javanese who work here. I mean,
Mm-hmm.
our plumber and electrician, I gave him some shoes to go home for uh, Ramadan or something like
Yeah.
that, right? I mean,
Mm-hmm. Mm-hmm.
that's I couldn't believe that somebody who's a skilled worker like that uh, would need shoes. Good Lord. Well, uh, you know what I mean? It's like our housekeeper, our pembantu, the drivers we use and everything. We know their families and everything, and um, it's much easier for us to live safely than it is for them. So
Yeah. Yeah.
I don't want it before they've had it, you know?
Yeah. Well, that's very considerate of you.
Um, well, I just think it's bad karma too, you know? I mean,
Yeah.
Lord, bad public relations.
Yeah.
Yeah, I think expats ought to be the last.
And what about I mean, I don't know about the last or the first, but I mean, this issue of equality is always exists in the world that we live in,
Yeah,
isn't it?
it, it,
But like,
yeah.
if the vaccine is out, would you take the one here, or would you go back to the
I
US
don't
just
go
to get
back to the
vaccinated?
U.S.
Right, okay.
It's too
But
expensive.
if
No, I don't worry about stuff like that. I don't worry.
would you pay for it if you have
Oh
to?
yeah,
Yeah.
I'd be happy to pay for it. Uh, I'm more concerned about, I'm thinking about, Katrinka is in BWA, right? Bali International Women's Association. And she
Oh,
deals a
yeah.
lot with poverty here. There's people who are very,
Yeah, yeah.
very, very poor, like especially over in East, no, in e, in the East, yeah. Uh, and I know that uh, that people I know, women I know in Biwa are going to want to make sure that some of the communities they're involved with there, which are many of them, are
Hmm.
taken care of because they do medical and dental clinics and things. Um, anyway, that's just thoughts I have there. Uh,
Yeah, and I can imagine they could be like the last people in line
that's
to
right.
get the vaccination.
And they shouldn't be the last in line because they are they're going to be the worst at wearing masks and practicing social distancing and all that. Uh, it's much easier for expats. The only thing is the expat community tends to be older.
If as a public health policymaker, they want to allocate the the first batch of vaccine based on where is the highest risk of population
Right,
lies in, and that says the medical professional or the elderlies,
right,
then it makes sense for them to allocate it firstly in those population,
right.
right? So it's and whether or not it's an expat and it's a local, I think it shouldn't matter.
Uh-huh. Yeah, I can see that.
Yeah,
Well, I'm 75. By the time that's out, I'll be 76. Uh,
yeah.
so, uh, uh, Katrinka and I would be high on the list.
Mm,
Them, but anyway, like I was saying, I'm a writer and have websites and stuff, and I love uh, to be in quarantine. All I want to do is get enough exercise, and I can do that
yeah,
easily. Uh,
yeah,
I, uh, socializing to me is um, it's fine. I enjoy it. I like everybody I know. I just want to get back to work or get back to you know going swimming or something. But a lot of people they've got to work and they've got to go to all these ceremonies and
yeah,
all that, and they've got to do all this socializing. So I'm not so
yeah,
concerned about myself. Although we
yeah,
relate
yeah,
to a lot of people, there is a stream of people that come in and out of here, mainly Indonesians. You know,
yeah, yeah,
delivering and doing the gardener and drivers and different things. But they're all very careful, all wearing masks.
mhm,
You know.
yeah, yeah.
Um, anyway, you need to go somewhere at 5. You said.
Yes, actually. But yeah, I just need to get ready.
Uh huh. And oh my gosh, it's 5:10. I'm sorry, I've kept you.
No, that's okay.
Uh huh.
That's okay.
Um, listen, it has been great talking with you. Uh,
You too.
let me mention some of the things I would have asked about if we had more time. I
Yeah,
would
yeah.
have dug a little deeper into your education and your experience in England and that, and anything you have to say about Hinduism,
Oh, yeah.
about climate change.
Oh, wow. Oh, I would love to discuss all that. Would that be okay if we do the other sections for like another day, you think?
Oh, you mean like soon? Yeah, I'll do that.
Yeah.
I didn't want to impose on you. Yeah.
Oh, no, no. I would love to have that other
Okay,
section as
great,
well.
great. And
Oh, great. So let's say maybe next week, Tuesday or Thursday, same time?
Tuesday, 4
Tuesday.
p.m. Yeah,
Yeah, I
good.
could do that.
Better to do it
Great.
soon while, strike while the fire, what was there's a phrase.
Strike while the iron is
The
hot.
iron is hot. Very good. Very good. Hey, you get an A plus in your English for that one. Uh, that's great. Well, you're younger. You see it all. When you get older like me, all the details start disappearing. All those places where all that's stored.
That's okay. You only remember what matters, what's important.
Yeah,
After a while, being able to remember all the phrases, the sayings, it doesn't really matter, I guess.
I'm not worried about it. I'm not worried about it. Yeah.
Yeah.
Um, yeah. Hey, wonderful talking with you. It's really a
You too.
delight.
Thank you so much for having me.
And I hope not to see you at work. And
No, me neither.
and although it's a very nice place, and I know we're very close with one of your colleagues there, Kim.
Yeah,
Uh,
yeah.
and I look forward to next Tuesday.
Yeah,
Okay.
yeah. Sounds good.
All right.
Sounds like a plan.
Okay. Take care.
Thank you. Thank you. You too.
Bye bye.
Bye.
So thank you very much, Dr. Raya, Dr. Ida Ayu Narayani. And hey, I'm going to call you next Tuesday at 4 p.m. And that's, when I'll record it and give me a little time to get it together to upload it on like Thursday afternoon, Thursday evening here, which will be like Thursday morning early if I get it up on time in America. All right. So, very good. So until we meet again, this is DC Poobah of Cuke Audio and Cuke Archives, coming to you from sleepy Sanur with Doggett, Bandita, Feline Cuchita, and dear lovely Katrinka. And we're wishing you and yours and all of us a grand awakening.